to everyone. We have here Alfredo Sabreda from Peru and Romina Caperino from Argentina too, sharing this presentation with me.
Awesome.
Okay, next one, please. We had this Congress in Argentina recently with around 2,000 attendees and 10 sessions related to addiction medicine with the participation of several national experts in person and these ISAM ambassadors, Pablo Félix from Uruguay, Daniel Martinez from Chile, and Teobaldo Llosa from Peru. And the inaugural conference was held by Ivan Montoya of NAIDA about medical consequences of drug abuse. It was a great success. Thank you to ISAM for this possibility, because you help with the participation of Ivan in this meeting. Next, please. And next to in the conference, we have an ISAM and ISAP meeting, a joint meeting, the International Society of Substance Use Professionals, with the presence of other national ambassadors of ISAM, like Carlos Ibáñez from Chile, Alicia Chu from Peru, and others. And we have the welcome words of Alex Baldacchino. Thank you very much, Alex, for your support. And Livia Ediger, who is the Vice President of ISAP. And also were present Gigena Kalowski. She is the head of drug demand reduction of the Inter-American Drug Abuse Control Commission in person, and Barbara Correa, coordinator of national Spanish speakers chapters of ISAP, and Roberto Canay, who is the national representative of ISAP in Argentina. It was a great work, and we have a lot of plan together. Next, please. We have there this conference of evidence-based treatment with Gigena Kalowski. Next, please. And next to this Congress, after this Congress, we have the ISAM regional meeting of ABEAD in São Paulo, Brazil. ABEAD is the Brazilian Association of Studies in Alcohol and Drug Abuse. It was also a big conference with 600 attendees, and we have national experts from Brazil, and thanks for the great work of Alexandra Dill. We have many activities. I will show you briefly with the presence or with the attendance of Felix Kessler, Flavio Pechansky, friends of ISAM from many years. And we have an ISAM symposia with Ivan Montoya too. Next, please. Thanks to Alexandra excellent management, we were able to visit several treatment centers, about 600 kilometers. All the roads in the state of São Paulo, visiting many places. Mainly those places like Barrial Institute, more than 800 beds, 60% beds oriented to substance use disorder. And the second place we have visited is the hub for care to crack and other drugs users in an interesting place called Cracoland in Brazil. That is a huge amount of drug addicts on the street, and all the services for these people. At my side, and the second picture is the director, who is Dr. Quirino Cordeiro, who was the director of mental health, the national director of mental health and addiction of Brazil. Next steps, of course, our meeting in Marrakech and a meeting in Montevideo with the support of Pablo Félix, also in November. And I will show you next slide, please. All the ambassadors and I hope friends that we have made in the region. And thank you very much.
Thank you very much, Dario, and it's just amazing to see the progress, and it would be kind of helpful for other ISAM regional representatives to see the structure that Dario is making in terms of defining the national ambassadors and also kind of regional experts and national experts, and also bringing others to collaborate. And also we have an opportunity that regional representatives can have a deputy for themselves to kind of help them in the process. For example, in some areas of the world, there are two other or three other languages that are active other than the language that the regional representatives speak. So they can basically find another person. For example, in Central Asia, we have countries that they speak Russian, and the regional representative found another deputy who can speak Russian to be able to connect to those countries that are Russian speaking. So that is an opportunity in terms of finding a deputy for your region. And also you can have assistants. So you can introduce assistants in your regions, and just, I mean, especially kind of with young addiction medicine specialists and those who are kind of medical students, those who are going to be the future of addiction medicine, so they can be your assistants in that process, and you can involve them within the network that you are making. Alex, you have a note.
Yes, Dario, as ever, I'm really happy, how things are going in South America. I can thank Gregory as well, for the introduction and initiatives way back about 5 years ago. And now we have so many people, so many activities. So Dario, you almost know exactly what I'm going to ask you. When is the fourth South American Spanish-speaking regional meeting going to be held in 2024?
Actually, I have a proposal from Ecuador for next year. We are waiting for the details to share with you, but probably is Ecuador. I hope Chile, Ecuador. I think those places are the more able to organize this.
Thank you, Dario. Much appreciated.
You're welcome.